Hello everyone, welcome back to my YouTube channel Dr.Barki's Ophthalmology Tutorials. Today we will discuss about primary deviation and secondary deviation. So in this video I will be telling about what is this primary deviation and the secondary deviation, where exactly it is seen or what is the clinical importance of it and how it happens. Before going further into the details of this video, I request you all to subscribe to my channel because 80% of viewers of my channel have not subscribed to my channel. If you feel that you learned something out of Dr. Barki's ophthalmology tutorials, please do consider subscribing to my channel. Okay, so let's go into the details of the topic today. So what is primary deviation and what is secondary deviation? So this is important in your squint evaluation, right? So whenever a patient has squint, suppose my left eye is deviated inwards, means I have left eye esotropia, then my right eye will be the fixating eye and left eye is the deviated eye. So what is primary deviation? It is the amount of deviation in the squinting eye. Okay, that is in the example I have given, this is the amount of deviation which is seen in my left eye. Okay, so now we will see what is secondary deviation. If you continue with the same example I quoted, that is there is left eye esotropia. So if I ask the patient to fixate from the deviated eye, that is the left eye is taking a fixation, then there is some amount of deviation in the right eye. So this amount of deviation which is seen in the normal eye when the paralytic eye is made to fixate, that is called as secondary deviation. Hope this is clear now. To repeat it again, the primary deviation is the amount of deviation in the paralytic eye, whereas the secondary deviation is amount of deviation which is seen in the normal eye when the paralytic eye is made to fixate. Clear? So where it is important? So it's very important when you want to differentiate a paralytic squint from a non-paralytic squint. In case of paralytic squint, this secondary deviation will always be more than the primary deviation, whereas in non-paralytic squint it will be same. Means both primary deviation and the secondary deviation will be same. And this point carries more importance when the patient is having paresis rather than the paralysis. When there is obvious paralysis, anybody can tell that it is paralytic squint. And when the patient is having paresis or the evolving paralysis, then it becomes little difficult to differentiate between paralytic and the non-paralytic, and there the role of primary deviation and the secondary deviation becomes more important. So why it happens? So if you continue with the same example I quoted, so I have the left eye esotropia because of this lateral rectus paralysis. So what happens? There is some amount of deviation in the left eye, that is there is esotropia in the left eye, and you measure this with a prism and say you got some 15 prism diopters of esotropia. So when I ask the patient to fixate with the paralytic eye, means so I have to occlude the right eye, right? So once there is occlusion of the right eye, this left eye tries to come to the primary position to take a fixation. So what was happening normally, say this lateral rectus was receiving some 5 units of energy from the brain to take it to the normal position. Now since there is paresis or the paralysis of this left eye, this lateral rectus, that is the lateral rectus of my left eye, is getting some 20 units of energy from the brain. So it is trying to come into the normal position or the primary position with 20 units of energy from the brain. Because of Hering's law of equal innervation, the yoke muscle to the left lateral rectus is right medial rectus, right? So when it is trying to take a fixation, because of more innervation to the left lateral rectus, equal amount of innervation goes to my right medial rectus muscle also. So this will go into the deviated position, that is esotropic position. And this amount of deviation which is happening in the normal eye is more than the deviation which was seen in the paralytic eye. Okay, so to summarize this, what is primary deviation and what is secondary deviation? Primary deviation is the amount of deviation seen in the paralytic eye. Secondary deviation is amount of deviation seen in the normal eye when the paralytic eye is taking a fixation. Where it is important? It is important to differentiate the paralytic from the non-paralytic squint. And why it happens? It happens because of the Hering's law of equal innervation. So the equal or the more amount of energy goes to the yoke muscle of the other eye, hence there is more deviation. So hope this short video on primary and secondary deviation is helpful to all of you. If you like my videos, please do subscribe to my channel. Press the bell icon for further notifications. Please do like and share my videos. Thank you so much.